Kane from Citizens Action Wisconsin. He's going to talk to us about what the impact is on Wisconsin, and also what can we do about it. What can we do in the face of current situation where ACA isn't being implemented in the state. So I want to just kind of get Kevin back up here and give him the time. Thank you.
Hi everybody. Can everybody hear me with this little microphone set up here? All right, great. I'm going to put something up in a second. But I want to let you guys know that I come from this from a kind of different perspective than our last couple of presenters. My own personal perspective is I don't have a healthcare background originally. The reason that I'm up here talking is because I, like many of the people in this room and those that you know, got sick once and now I'm suffering for it forever. A little over 2 years ago, I developed, I graduated from Marquette University and I was trying to do what so many other people in my age group was trying to do, find a full-time job with benefits. There were not a ton of those available at the time, unfortunately, and not when I moved back home with my parents. Nothing wrong with that, just not much fun. I ended up working any job I could find to put food on my table. In fact, I worked 8 jobs in a year. I moved 4 times. None of those jobs gave me health insurance. But I tried. I tried being responsible. I was on Badger Care for a little while. I tried buying private insurance until I couldn't afford it anymore. I tried being responsible. But I'm young. I'm invincible. Went back to when I need it, right? Until I woke up one morning and I wasn't that case anymore. I woke up one morning and I couldn't see. I woke up one morning and I felt like I had been stabbed in the eye, and I did what any 21-year-old at the time with no insurance would have done. I left them alone and hoped they went away. Don't do that. It doesn't work. When I finally went to the ophthalmologist, he said, "We have great news for you, Kevin. You have a rare and interesting condition. We might write a paper on it." There's some good news. What does that mean for me? Oh, you'd be blind in a week. But there's one reason why I'm here today. There's one reason why I was able to drive to be able to do this presentation, and that's because of the Affordable Care Act. So I've actually been able to come on and do presentations explaining what is in the law to people, so people understand what this means for us as a consumer. In fact, we've been doing presentations at Citizen Action Wisconsin for the last year. This is our 186th presentation to 29 cities in a year to 6,000 people. I may have seen this a couple of weeks before. So I'm going to quickly go over what this means for Wisconsin, what it's going to look like moving forward. The first thing I want to do is, I promise you I won't use an acronym, just right off the bat, at all for the rest of the presentation. But I also want you guys to know that I think that it's really simple to boil this law down to one quick thing. This law means that insurance companies have to play fairly. It means that, they can't rip you off anymore. And all the different provisions and all the different parts we've heard about it are just a great way of helping us understand that. They can't deny you because of pre-existing conditions. They can't charge you more no matter what gender you are, if you've ever been sick. They have to cover preventative care with no copays, no deductibles, no out-of-pocket costs. You get a rebate at the end of the year if your insurance company spends too much of your money on health insurance, on profits, overhead, paperwork, whatever. Your money is going to your health care. Insurance companies have to make sure that you know what it is you're buying. No more fine print. In fact, there's actually a rule there that says insurance companies can't have any print smaller than 12-point font. So I'm going to go over just a couple of key changes. I'm usually not a big... Oh, I think I just turned it off, huh? There you go. Come on, hit public. There you go. We're going to navigate the maze together. It's going to be a lot of fun. That's about the Supreme Court right about there. Yeah, we're a little bit fun. Alright, so the impact on Wisconsin. What is this Affordable Care Act? What does it mean? Why are we talking about it? And how is it going to impact you? Normally I go around and just give presentations on what's in the law, how to talk about it. I'm going to do a little bit more specifics. I'd love to answer any of your questions, and I will of course stay afterwards because plenty of people have questions. But I'm going to throw a bunch of quick numbers. 200%. That is the amount healthcare costs in Wisconsin have increased over the last 10 years. For those who are not super math savvy, that means it's doubled in the last 10 years. All right, that's rose faster than wages, inflation, profits of small businesses, taxes. It's becoming a huge burden on families, businesses, governments. Really, we have to address this healthcare cost. We have to. There's really no other option here. Less than one-third of small businesses in Wisconsin cover employees now. All right. Engines of our economy, we got to make sure that they cover people. There are 94,000, oh, that's an extra zero thrown on there. 94,700 Wisconsin children who have been diagnosed with a pre-existing condition that can lead to denials of care are protected today. And that's kind of a bureaucratic nonsense word, but I want you guys to understand that conditions. Pre-existing conditions, that's everything from cancer to diabetes to lung disease. Basically, if you can think about it, it's a pre-existing condition. There are 1.3 million adults, roughly 1 in 3, who have a pre-existing condition that would cause them to be discriminated against before 2014. That's under 65, by the way. To put it in perspective, that's more than all of Waukesha County and all of Milwaukee County combined, and quite some more, actually. So that's a lot of people. It's as if these entire counties were suddenly charged more or denied insurance. Thanks to this law, and I apologize, I just put a little maze thing together today, there are over 300,000 people, because of the Affordable Care Act, uninsured people today, who will get coverage because of this law. Individuals who have been going to the emergency room, or putting off care, or doing all sorts of other things that's not been beneficial to their health. And so when the time comes that they do get sick, or an accident does happen, or they have a child, if they don't have insurance, who pays for that? We do. So I'm pretty sure it's in our best interest that these people find some form of coverage, and we make sure that they get it in a way that's both beneficial to them, to their health long term, and make it so we as a society can pay for it much more affordably, much more effectively. A couple more numbers for you. 918,300 seniors and others who are on Medicare, who have access to free preventive services such as mammograms and colonoscopies. Anybody in the room on Medicare? Anybody in the room who's on Medicare did raise their hand the first time? All right. Have any of you guys taken advantage of an annual wellness exam in the last year?
Yes.
A couple of you? That's because of this law. All right. In fact, and I know there's more that raise their hands, because actually the number is about 68% of people on Medicare have taken advantage of free preventive care in 2011 alone. Most people are taking advantage of this idea that we should treat conditions early, keep people healthy, because I know every single person in this room knows that a cancer screening is a heck of a lot cheaper than chemotherapy, and much more beneficial to you long term. In fact, there are over 1,111,000 people's private insurance that has added coverage of preventive services without cost sharing already. I actually went to the doctor fairly recently, and my entire doctor's exam was covered under the Affordable Care Act by my private insurance company through no co-pays and no deductibles to make sure I stayed healthy and caught conditions early. All right? This is fantastic. We want to make sure people stay healthy. We want to save money long term and all sorts of things. In fact, today, very important day today, a large number of women's health prevention topics have changed. Keith mentioned it toward the beginning. Things like domestic partner abuse counseling, breastfeeding supplies, contraceptives, etc. All sorts of things going on here. There are 64,000 Wisconsinites that got a rebate check this year for the prescription drugs they buy through Medicare. Anybody on the Medicare Part D plan? Okay, there's more than that, I know that. Many people found themselves stuck in a loophole that made it so they were stuck paying a ton out of pocket. Some of you have heard it, the Medicare Part D coverage gap, the donut hole. That hole is going to be closed, and we're going to make sure that people get a rebate if they've been paying too much out of pocket. There are 2,142,000 people that have a lifetime limit on their policy. Anybody know what the term lifetime limit is? Can we explain it to me, like, really quickly?
It's how much they pay out for you over your life. And if you
Exactly. Yeah, it's kind of like a price tag on how much you'll get paid out over the course of your life. I hate to be glib like that, but it's a number like $1 million or 750,000, maybe even 2 million. It's this idea that there's a maximum amount, and if you cross that, you'll basically be dropped or you're on your own. Now, this is actually the leading cause of medical bankruptcy in America. And medical bankruptcy is the leading cause of bankruptcy in America. So it really behooved us to make sure, and by the way, the American Cancer Society hates this thing because people on cancer hate this all the time. They were very excited when this part got taken away. So we, in just one fell swoop today, make sure that people are not finding themselves in bankruptcy because of medical bills that didn't have to be. By the way, these are all Wisconsin numbers, I should mention. These are not nationwide. These are just specifically Wisconsin. 1,536,000 people are protected by the new caps on insurance profits and overhead. The 80-20 rule, the rule that 80% of your money goes to actual health care, 20% of it can go somewhere else. That actually seems like, anybody who's a small business owner familiar with it, 20% profits? That's not too bad. In fact, insurance companies in many ways had a lot higher than that. And if they don't do it this year, you get a rebate by your insurance company. There might be a few people in there. Maybe get an insurance check this year. Oh, awesome. Love it. In fact, $10.5 million in rebates this year alone to Wisconsin consumers by insurance companies that did not follow that rule. All right, that's fantastic. This year alone. Wait, just you see that little skip over the Supreme Court thing? There's it's constitutional. Very sad. There's 38 million and some change. That's how much Wisconsin received to build this competitive health marketplace, also referred to as an exchange. We mentioned earlier this place where you will go to purchase health insurance that's fair, competitive, and cannot discriminate or deny you. And actually, fun fact. Your member of Congress has to get their insurance from this place too. All right, fun fact. Yes, anything they can get, we can get, and vice versa. All right. Unfortunately, that's also the amount of money right here that our current governor returned to the federal government because we didn't want to create this this place where you can't be denied insurance. You get a tax credit to pay for your coverage, and you can fairly and accurately understand what it is you're buying. Back in December, they decided we're not going to institute anything until the Supreme Court makes a decision. All right, that's fair. All right, the Supreme Court was taking this law under consideration. Maybe we should